The World Health Organization declared monkeypox a global health emergency yesterday.
Now, health experts and those most affected by the virus are working on limiting its spread. CTV's Austin Delaney has been following the story and joins us live with more. Austin.
Well, Torontonians at risk of contracting monkeypox appear to be taking that WHO warning seriously and are seeking protection. This as the virus spreads rapidly around the world. A lineup out the door at a monkeypox vaccination clinic today at Metro Hall, a day after the WHO declared it a global emergency, a disease that predominantly affects men.
If you look at the line right now, absolutely, there's a lot of folks, especially gay men in the community, coming out to get the vaccine.
Terry Brand says he listened to the WHO's warning and being gay came today to get the jab.
We've been identified as a target population, right? So being at risk, right? So I think it makes sense.
Because I'm being responsible to myself, I'm in turn being responsible to others.
Toronto's medical community applauding the WHO's emergency declaration.
This was definitely the right move. This meets all the criteria for it, and this really signals to the world that this is an infection that needs to be taken seriously and that countries should be mobilizing to really gear up on their outbreak response.
Dr. Isaac Bogosh suspects the number of cases reported worldwide are just the tip of the iceberg and is calling for a coordinated response, including data sharing, saying the WHO's emergency declaration will facilitate that.
Infections know no boundaries, and if there's a problem on one side of the world, it can be a problem on the other side of the world as well. And that's why it's so important to recognize this as a global issue, not just a regional issue.
Much is still unknown about the monkeypox virus that spreads in Africa from rodents to people. But here, it is spreading from close contact, person to person.
What does this virus do? Well, it does cause very significant skin issues and problems, and in a minority of people. But this is important. We care about minority groups of people, including children and pregnant women and those who are immunocompromised. They are at higher risk of serious complications and even death.
The research is so important right now because experts do not know why it is spreading from person to person in North America and Europe, and so quickly. And in Ontario, cases are on the rise. There are currently 288 in the province, 3/4 of those right here in Toronto. There have been no deaths in Ontario. Reporting live, I'm Austin Delaney.
Thanks, Austin.